We are, by the way, passing out whatever the slides to you, and I don't have that many, about 20 copies. Whoever wants to have them, please have them, and you could, communicate to your fellows and post in your clubs, societies, whatever you want to do. That's your material. I just want to make one point in each hospital. This hospital, a small hospital that I personally built from scratch in a small town 15 years ago, received, next slide please, it received top 100 hospital in the nation 4 times. 03, 4, 6, and 8. And also it's top 1% of the hospitals in the nation. Unparalleled for a small hospital. Next please. Okay. This hospital, Chino Valley Medical Center, we purchased it in the bankruptcy, where there was no electricity in the hospital to turn on the lights. Today, it's a premier hospital. Next slide, please. Okay, it received several commendations, and I don't want to go into detail. Sherman Oaks Hospital, you might have heard about Grossman Burn Center, yes. Okay, which is a famous burn center. This hospital was in default of paying state debt for 3 years in a row, and we acquired this hospital. Now it's a leading, thriving organization, including Grossman Burn Center. Next, please. Okay, this is another hospital. Next. Next hospital, next hospital. By the way, the previous hospital, in 2 years under our management, now, look at that, top 100 hospital in the nation in 2008. That's our first year of our operation of that hospital. Another hospital, next. Okay, this is a hospital for 105 years, managed by Adventist Health. The Adventist leader, Ellen White, on a vision, went and started this hospital 105 years ago, and that was going to be shut down. Okay, and we acquired that hospital now 3 years ago and turned it around into a premier hospital. This is where we have acute rehab that is well recognized in Southern California and highly reputed. Next, please. Okay. This is Sentinella Hospital, very famous hospital where Phil Jackson had his both hips replaced, and all this kind of stories. Hospitals of the Lakers and the Olympics and all that. And that was in financial distress, and we acquired it about 2 years ago, and we turned it around into a successful hospital, serving the most deserving community of Inglewood. And this is the most prominent safety net hospital next to LAX, 5 miles from LAX. Next, please. Another hospital. Next. Another hospital. Another hospital. This one is our most recent acquisition in Northern California. Redding, used to be Redding Community Hospital, had financial troubles under tenant, was acquired by some other operator, could not operate, and finally now we acquired it, and we are in the process of turning it around, and that brings us at least closer to 200 miles from here, in our first entrance to Northern California. Next, please. Okay. We are physician-driven and patient-focused model. I'm the head of the organization, and we employ, we appoint a medical director, what we call chief medical officer at each hospital, who reports directly to me about the medical, clinical issues. We're the only one that pay attention to the patient care issues in the administrative office. Okay, next, please. Important things, you could see, I already mentioned them. Focus on quality of care, capital infusion, reduce unnecessary hospital stays and length of stay, improve ER efficiencies, decrease, I already went through these things, and improve the plant operations. Next, please. We pay a lot of attention to the quality measures. These are the published data through Medicare. And when you say which hospital is good and which hospital is better than other, you go to this public website and compare the hospital data that are publicly available. I'm going to share a few of them with you. Next. Okay. acute myocardial infarction, that means heart attack. That's my specialty. Look at our hospitals compared to the state and national average. We perform the lowest 90, and maybe that's the hospital not under management for a long time. And it will be 100 one day very soon. And we try to get every hospital at 100% of quality measures. Next. Okay, this is for heart failure, but almost at 100%. Next, please. Pneumonia. Look at our measures compared to the national and state data. Next, please. Okay. These are the things we did for every hospital. And I don't want to go through complete details, except we upgrade the equipment right away, no matter what. Okay? These are the things that we have to have, and we will have if they're not in the hospital. One is PAC system. It's a filmless digital radiology. You can read the x-rays from anywhere. The doctor happens to be attending his own wife's delivery, Lamaze lesson. He could take his laptop and read the x-ray and send the report right away. Okay? Every hospital has it. And our supply of pharmaceuticals and other supplies are always automated, therefore there are least amount of errors. That's called Pyxis system. We have upgraded radiology in many places. Next, please. Okay. Now, this is the first time I'm doing Prem Healthcare Services, 13 hospitals to date with more, about $1.2 billion in revenues a year. It's a for-profit organization founded by me. It's a for-profit organization. But why am I talking about not-for-profit? During these years, last several years, I personally contributed about $60 million to charity, and that is held by Prem Healthcare Services Foundation, which we spend every year $1 million or $2 or $3. Okay. But still it has $60 million. So recently, not recently, a few weeks ago, I thought, if I'm doing it healthcare and I'm earning it through the healthcare, why can't I have this foundation acquire certain hospitals under not-for-profit and turn them around? It's the same amount of service that I'm doing for in the for-profit category. So that's how this idea came. We have $60 million in the foundation, no debt whatsoever, so we're thinking of using it for this facility if we are the successful bidder. And if not, I'll use it somewhere else. Okay, next. Okay, now, just I mentioned the points, and I'm going to reiterate them because these are the important points that you want to take home. Prime will continue to maintain emergency department, operate San Leandro as an acute care facility. This is something you might want to ask Sutter or whoever. I mean, I don't believe Sutter, I don't know much details, except I wrote down a point here from the slides that they were presenting. From June 30th, they would give 90-day notice and shut down the hospital. I think that's unfair. To even if we are chosen or anybody is chosen, it will take more than 90 days for us to get licenses, for us to rehire the staff, to apply the Medicare number, Medicaid number, or Medi-Cal number. So that kind of an option for Sutter to be able to shut down a hospital in 90 days is totally, grossly unfair. I think you, the community, should address this. If Sutter wants to maintain it as an acute care hospital, we will be very happy, and you should be too. But you should insist on keeping the hospital emergency room open, and the services, all levels of service, to be open at the same level, at least for the next 5 to 10 years. Okay, that is the important thing. If Sutter wants to do that, hats off to them. We don't need to be here. Okay, but if they're not doing it, they're going to do it. Okay, we will look into that after we exercise the option. We may open this emergency room, or we may keep 10 beds, we may keep 20 beds. No, you, the community, needs better promise than that. You deserve more than that.